By the third week of Wuhan's lockdown, over 10,000 COVID-19 cases were confirmed, and tens of thousands more were suspected in the city. And all efforts were called on to save as many COVID patients as possible, as President Xi Jinping prioritized hospitalizing those with COVID. She also said that the government put forward the prevention and control requirements of early detection, early reporting, early isolation, and early treatment.
We need to take all severely ill patients into hospitals. We cannot relax on works of taking patients into hospitals.
With the central steering group sent by President Xi to Wuhan, 2 emergency hospitals offering 2,600 beds were set up and started running. However, with daily confirmed cases quickly reaching the thousands, it meant 2 such hospitals needed to be built every day. With not enough hospital beds and the incubation period for COVID up to 2 weeks, many COVID patients were still on the streets. The Central Steering Group organized rounds of screening in communities to find all COVID carriers, taking people's temperature and checking them to make sure they didn't have any COVID symptoms. In order to take in all these COVID infections, it was decided to convert public buildings such as stadiums and convention centers into temporary hospitals for non-severe patients.
The most important function of those temporary hospitals is to isolate COVID patients from healthy people, which is a very important step in the prevention and control of infectious diseases.
In addition, dozens of quarantine centers were opened across the city, including converted hotels, to take in those people who came in close contact with the virus. This teenage girl who had 4 confirmed coronavirus patients in her family was transferred to a hotel, modified into one of those isolation facilities.
但就是你现在有发烧吗？或者有其他的症状？
我没事。
是愿意来被隔离吗？你觉得现在是有必要吗？
我觉得还是有必要的，因为如果还在家里的话，可能自己也会被感染，感染人太多的话，也不好。
想到我们像这样子的一个密接隔离点，它的意义在这是什么呢？
The isolation is a means of preventing infection between people. It's possible for people to get infected after having been in close contact with confirmed cases of the coronavirus. We need to isolate them and put them under medical surveillance.
At the early stage of the outbreak, the death rate in Wuhan hovered around 5%, double the national average. China's leader reiterated several times to reduce the infection rate and the death rate with effective treatment programs.
看一看，看到没有？你活过来了，活过来了，看到没有？
The death rate started a job, and some doctors even found out ways to help those critically ill patients.
Our survival rate is 100%. While ECMO can help patients survive longer, its largest significance lies in early intervention in order to stop patients' conditions from worsening.
The fatality rate was very high in the early stage. Reasons for that include the delay of incubation, hormone treatment, and even the use of some drugs, such as the broad spectrum of antibiotics. These might have led to a significant increase in the risk of death of patients in the later stage. But looking back, we can see that later on, with positive measures taken and the recognition of those limits in early treatments, we have this data that shows a significant decrease in the fatality rate.
Data show that by the end of March, the COVID-19 death rate in China stabilized at around 4%, while some countries were hitting 10%. And the cure rate in China, over 90%, was almost double the second highest cure rate achieved by South Korea.
经过艰苦卓绝努力，付出巨大代价，中国有力扭转了疫情局势，维护了人民生命安全和身体健康。
With China's focus on early detection, early reporting, early isolation, and early treatment, the spread of COVID-19 was tamed. The top marks on cure rates prove that China is on the right track. And from newborn babies to centenarians, The Chinese government promised to save everyone hit by the virus.